And what do I remember about the injury? Well, it was the end of the day, so like 4 p.m. It was a very hot day. It was Sunday. We decided, well, let's go to your aunt. She has a pool. We'll swim, take the kids. We'll make an afternoon of it. And so it was the end of the day. I had been in the pool all day. I was just talking with their aunt and uncle and cousins and stuff. And I said, let me go in the pool. And there's a slide into the pool. So I figured, all right, I'll go down the slide. Why not? The big mistake was I went down head first. Having not been in the pool all day or going down the slide, I didn't realize that the way the slide was, it curved. And if you know pools, you shallow end, deep end, there's that angled area that goes, that transitions from the shallow end to the deep end. And where the slide curved, it aims you right into that angled area. And that's the most common area for people actually to break, get injured or break their neck in a swimming pool. And so yeah, that's what I did. I went down head first. I remember going down, going into the water, then I don't remember anything for a few seconds. Then I remember floating back up, unable to move. And I knew exactly what I thought. I was a medical student in 4th year. I'm like, I just broke my neck. Now, of course, the next thing was I'm face down in the water and I can't move at all. And I'm just hoping somebody figures it out. Like, there's something wrong with him. He's not moving. Let's go rescue him. Because I'm not sure how long I could hold my breath at this point. And it seemed like an eternity. But eventually, my wife came in, rolled me over, and like, I can't move. I'm paralyzed. But the other thing I was feeling is I couldn't breathe. I just couldn't catch my breath and stuff. The one thing you're not supposed to do is the one thing I made them do, because I figured it's either move me and maybe make my injury worse, or I'm going to die of suffocation here because I can't breathe. I need them to sit me up so I can breathe. So they took me over the side of the pool, got me out, and sat me out. Again, that's the one thing they would tell you never do. When you see people get injured, like a football field and stuff, you see them, everything's immobilized, right? You don't want to make the injury any worse. But for me, it was basically, as I said, between suffocation or chance of making the injury worse, and I took my chances. What do I remember about the subsequent medical assistance? Well, from there, they called an ambulance. The ambulance took me to Carlisle Hospital. This is South Central Pennsylvania, if anybody's from that area or know about it. It's not too far from Harrisburg, so take me there, into the emergency room, and I learned one valuable lesson out of this, was really how not to deal with patients. Here again, I'm a medical student. We look into the ER, he does his examination, does his x-rays, and basically, he then basically walks up to my wife and, like, well, how's it doing? Yeah, he broke his neck, he'll never walk again. He turned and walked away. That's what he said. Didn't break it to her easy, no empathy, just straight out and walked away, and that was done. Well, from there, then they took me to Hershey Medical Center, again, by ambulance, and that was the worst ride I've ever had in my life. You're strapped to a backboard, so your head is right against this hard piece of wood, and they're taking you down 81. If anybody knows 81, especially back in the 80s, I mean, it was just pothole after pothole. Some of your head just smacking off this board, can't move, and you're driving whatever it is, 20, 30 miles to Hershey. I was in Hershey Medical Center for about 2 weeks. The first thing they did to me was they put you in bed, put a collar around your neck, put straps around your legs, and then they hang weights off your legs. Basically, they're trying to stretch your neck out so hopefully the vertebrae will realign. Now, where did I break? I broke my neck at the C6-7 level. So I'm a C6-7 quadriplegic. So again, so they hang this off, they're hoping it realigns. And when that didn't work, the next thing they do is they put you in a halo. Now, often they'll take you to surgery, But by that second day, I was starting to regain some strength in my arms. At first, I couldn't move at all. By then, you know, my biceps are working. I have a little bit of triceps and this thing. Well, why take you to surgery? Let's just see how much you recover, you know, on your own before we take you to surgery. So what they do is they put you in what's called a halo. It's basically just this stuff. It's a metal ring that goes around your head. They put screws, they screw it into your skull so that it's, you know, solid. And then there's bars that come down from it that attach to a vest. And that way you can't move your neck at all. And I was in halo from that day, this would be like Tuesday, through probably November. You're in that, and you can't move your head at all. You want to see side to side, you have to kind of twist your whole body. I was there for about 2 weeks, I said, then they moved me to Elizabethtown Rehab Center. And next question, briefly describe your rehab process. In rehab, you have the typical things. You have PT and OT and recreation therapy. Here's where I always put in my plug for recreation therapy. I think if I would have known about recreation therapy in high school, I probably would have become a rec therapist instead of going to medical, you know, actually going to college, going to medical school. Because I think it's one of the greatest jobs ever. You get paid to play. I just can't imagine. I mean, it's like being a pro athlete, but kind of on a minor scale. I mean, you know, you go PT, OT, you go into the rec therapy area, and you're like, what do you want to do? You want to play ping pong? You want to play pool? You know, they would set you up at pool. And then in the evenings, they'd come around and like, all right, we're going out to eat. And of course, the idea is to get you back into the community, right? So, where do you guys want to go eat? Oh, steakhouse? Okay, great. We'll all load you up at 6 o'clock, and they would take you out to eat. And then maybe 2 days later, we're going to the movie theater. So what movie do you want to go see? Well, it's the same thing. These guys get to come along, and they get their way paid. They're actually being paid to take you out to eat. So that's just my plug. Rec therapy, if anybody's looking for a profession, yeah, that's probably not a bad way to go. What physical problems do you experience, if any? Temperature regulation, balance, spasms, gagging. When you break your neck, or any, well, you break your back, any place. Depending on the severity of the injury, as I said, I'm incomplete, or it was, in that I had actually some feeling below my level of injury. I had what was light touch. So if you just touched my leg, I could tell you were doing it, but I had no pain or temperature. So if you took a hammer and hit me on the knee, I wouldn't feel pain. If you took a flame and put it up against the side of my leg, I wouldn't feel the heat. And of course, no motor function, so I really can't move anything below mid-chest, no hand function. I have some tricep function, and normal biceps, normal deltoids. So that's probably the biggest thing is loss of motor, loss of sensory function. Temperature regulation goes along with it. In your temperature regulation, right, you go mostly through your sympathetics. You go into a cold room, all your blood, your sympathetics activate, all your blood vessels constrict. That doesn't happen to me. You know, I go outside in the cold, it doesn't take long for me to get cold because my blood vessels can't constrict. That part doesn't work. The sympathetics are cut off at my level of injury. Same thing if I go out in a warm day, I can't cool down. I don't sweat below my level of injury. In fact, if I'm sweating, that's one of the other problems you get. It's called autonomic dysreflexia. If I have any problem below my level of injury, you know, my boots are on too tight. I have an ingrown toenail. I have to go to the bathroom, and I wait too long. It will activate the sympathetics that work below my level of injury on a reflex. So the stimulus comes in, your body says, oh, we've got to get away from it. Fight and flight reaction sets in. Then your blood vessels constrict, and your blood pressure can go way up. people with develop autonomic dysreflexion, quadriplegics, high paraplegics, it can be a life-threatening situation. And actually, I had it only happened to me once where I had to actually go to the emergency room. Because for whatever reason, I couldn't tap. That's another problem, of course. Bowel and bladder function don't work. So for me to urinate, I have to tap myself. Well, I just couldn't. I was in Canada at the time at our family reunion at the Highland Games. They finally wheeled me in, I wheeled myself into the ER. They take me back. My blood pressure is like 280 over 140. Does anybody know anything about blood pressure? Normal, anything under 140 over, let's say 9, anything under that, that's normal blood pressure. I'm 280 over 140. I mean, that's stroke zone. So, yeah, the nurse does what he has to do, taps me, I'm fine. My usual blood pressure, just kind of as an aside, or as comparison, I usually run about 80 over 40. That's my usual blood pressure. Again, because you break your neck, you knock off your sympathetics, you lose the ability for your blood vessels to constrict. So my blood pressure is always very low. And it's kind of a little test I do when I go to the doctor's office. I want to see if the person taking my blood pressure really knows what they're doing. If they're taking my blood pressure and they'll say it's 120 over 860. I said, no, it's not. I said, well, take it again. Because if I'm 120 over 60, that's hypertensive for me. You know, and you'll see, I mean, probably all been to a doctor's office, but they wrap that cup around and pump it up. Then the thing goes flying down. There's no way they can get an accurate blood pressure. So I test medical students the same way. I work at a medical school. You know, I have the medical students take my blood pressure just to see if they know what they're doing.